lower on the cases per 100,000. This is a good thing. You normally would expect, because of our density in Erie County, that it would be much higher than these other counties, but it's not. It's actually lower. Other counties and communities across New York State are seeing increases in their positivity rate, as well as their cases per 100,000 residents over a 7-day average. We are actually starting to see a decrease. So here's the case data on a week-to-week basis. So as of the week ending on Saturday, so December 11th, there was a 22% decrease from the week ending December 4th of total raw cases. And the weekly case count is now similar to the pre-Thanksgiving total. We did see a big Thanksgiving spike. We kind of figured we'd see a Thanksgiving spike. We saw it, but now we're seeing a decrease in cases, and we're seeing a big decrease in the rate per 100,000. As you can see, the 7-day case rate per 100,000 persons went to 455 for the week ending December 11th, down from 580 the previous week, and that has dropped even more as a result of the most recent 7-day period. So we're going in the right direction now as compared to where we were when it was really bad. And the weekly positivity rate for the week ending December 11th was 9%, down from 10.8% the previous week. And we do continue to see that number decrease, where it's kind of in the 8.5% now. So we are seeing good results in regards to its decreasing. There are still lots of new cases on a daily basis, but we are at least headed in the right direction, which is the cases and the rates per 100,000, and the positivity rates are going down. Positivity percent declined in all age groups, but children under the age of 18 continue to have the highest positivity rates. For children, or for ages 0 to 17, the percent positivity rate was 10%, so above the rest of the average. And for persons 18 plus, the positivity rate was 8.7%. So we're still having a problem with children having the highest positivity rate, giving it often to them from one child to another, whether it's in a school setting, it's outside of a school setting, it's in a child care, it's in sports. So we are still worried about that. That's why children need to be masked when they're outside of their home setting. And then in the 30 to 39-year-old age category, had the highest group case total, and they've had the highest 7-day case rate per 100,000. So it's the 30 to 39-year-olds, which are often driving a lot of our problems. Now for the week ending December 11th with the zip code, the high numbers are still there with regards to total new cases per 100,000. The 14202 zip code, which is downtown Buffalo, had the highest rate actually. Not a lot of people live there. Lackawanna was the largest community with one of the highest rates, and I'm very concerned about that. You see Collins is up there. There were 19 cases in the 14034 zip code. We do know that a portion of those were related to the Collins Correctional Facility, not necessarily in the general community. West Seneca, the 14224 zip code, actually had the highest number of raw cases, total cases, 238, and was in the top 10 for total new cases per 100,000. So it is in the urban areas, suburban areas, the rural areas, and there are some areas that are doing worse than others. Simple as that. So we remind everybody to wear a mask. It is important. Opinions are important, but facts matter. And we want people to understand that it is the facts that drive the decisions that we make. And we see, unfortunately, cases everywhere. The only good thing is they are declining as a percentage of our population and on the positivity rate, so that's good. But these are numbers we would have never imagined just a few months ago. So hospitalization, another good thing to talk about. We are seeing a stabilization in the hospitalization numbers. We had a big rise, and then we seem to have stabilized a little bit. What you have in front of you is the hospitalizations for the last 2 weeks. They have stabilized. We've seen them reach their high in Erie County of 383 cases on a day. They've dropped a little, but we have seen that number pretty much stay where it is in the last 2 weeks. The hospitals are still at or near capacity, depending on the hospital. We have had some hospitals that were at capacity that have opened up some beds, so that's a good sign. But ECMC is still at full capacity for all acute care facilities. I believe Sisters Hospital is as well. But Buffalo Mercy and Kenmore Mercy, which had no bed space, now have opened up some beds, so that's a good sign. On December 12th, 89.9% or 90% of all our hospital beds were occupied, and 88% of them ICU beds were occupied. That is a reduction from last week. Not a big reduction, but it is a reduction, and that's a good thing. We're 374 hospital patients on December 12th in Erie County hospitals. 522 of them were hospitalized across Western New York. We're going to go into a little bit more about that and why that is significant compared to where we were last year. So there were 149 non-Erie County facilities, beds. Let me strike that. There were 149 COVID-19 patients that were hospitalized in non-Erie County facilities in Western New York. So that's Niagara, Chautauqua, Cattaraugus, and Allegheny, as determined by the New York State Department of Health. So vaccination status, people ask this all the time. 69% of those that are COVID-19 patients in Erie County hospitals were not fully vaccinated. 77% of those that are COVID-19 patients in the intensive care units, the ICU, were not fully vaccinated at the time they caught the illness. 79% of those on an airway assist were not fully vaccinated. Now, I just want to remind everyone, airway assist is not as pretty as it sounds. It's generally a ventilator. You do not want to be on a ventilator. It is very bad, really bad. Dr. Burstein can go in a little bit more detail, but a ventilator is basically keeping you alive and hoping that you recover. And a lot of people who are on ventilators have long-term impact for the rest of their life due to serious issues with their lungs. So 80% or 79% of those that are on a ventilator in Erie County have not been fully vaccinated. Now, hospitalizations, I wanted to show these two charts. Here's the Erie County hospitalization data as of March 2020 to present. We talked, we said, I think 374 patients. Let me just go back, make sure I get the right number. Yes, 374 patients as of December 12th were in Erie County hospitals. And you see we are not near our high, which was over 450 back in early December. We have seen these spikes, but we are not near our high. But Western New York almost reached its high when you talk about hospitalization data this past week. It has declined a little bit, primarily because we've seen a decline in Erie County cases. But what the big difference is between last year and this year, look at, last year we were over 450 patients. This year we're 374, we reached about 380. So there was a difference of about 75, 80 patients in Erie County hospitals compared to where we were last year. But when it comes to Western New York hospitalization, it almost surpassed last year. And our ICU numbers were actually slightly worse than we were in the middle of last year. Not the beginning of the pandemic, but certainly in December and January. Why is this? It's because the other hospitals in Western New York are at capacity themselves, and they have many, many more COVID-19 patients than they had last year. They've been averaging 150, 155, 149 on the most recent day, as compared to where they were last year, in which it was 70, 80. Usually it was around 50. So there's been a big spike of COVID-19 patients in the other hospitals across Western New York, to the point where they are diverting patients out away from those hospitals to other locations, including in Erie, Pennsylvania, and Bradford. So we want people to understand this is a regional issue. The hospitals are still pretty much full everywhere. We're doing a little better in Erie. The other hospitals are very full. People are dying in Erie County just like they're dying, unfortunately, across the rest of Western New York. So the hospital data is pretty revealing to see we almost reached our spike of last year's total just in the past week, even though Erie County really hasn't come close to its spike from last year. It's because there's so many more people that are hospitalized with COVID-19 in the hospitals in Niagara, Chautauqua, Cattaraugus, and Allegheny County than ever before during the pandemic. Vaccination numbers continue to have high vaccination numbers, especially in the older age groups. We, unfortunately, still have lower numbers among children, but we do have a good sign, is that based on the data from New York State, all age groups 18 plus have at least one dose at 70% level. So no matter what the age group is, over the age of 18, every age group has an average of at least 70% of the age group at least having one dose. So we're doing better. As we talked about in recent weeks, we've seen more people get vaccinated over the age of 18 than we had seen in recent weeks. It's not thousands more per week. It's not even hundreds more per week, but it is dozens, where at various times in recent past it was just a handful. So there are more people across Erie County who are getting vaccinated for the first time, and that's a good thing. That means they're going to be protected, especially once they get full vaccination through them. Mortality data, unfortunately, we have to announce that 52 additional COVID-19 deaths through December 9th were reported. There was a small handful in November. The rest of them are in December. So to those who've lost a loved one, including those who may have lost a loved one in the last week alone, my deepest condolences and sympathies. It really is very sad how many people that have died. We have lost over 2,200 people from COVID in Erie County alone, 800,000 in our country, and unfortunately many of those deaths could have been prevented if individuals had been vaccinated. Of the 52 most recent county residents to have died or confirmed a death, 3 persons were under the age of 50, and we can confirm that all were not fully vaccinated at the time that they caught the illness. And for Erie County COVID-19 deaths since July of 2021, the average age of those who were fully vaccinated, just to remind you, fully vaccinated is still confirmed to be 2 weeks after 2 doses of the Pfizer and Moderna, and 1 dose of the Johnson & Johnson. That may change in the future, but it's still the older standard. The average age was 82. For those who were not fully vaccinated, the average age is 71. And as we've noted lately, not everyone, but almost everyone under the age of 60 who's died from COVID-19 in Erie County in recent months was not fully vaccinated. Erie County responds. Well, let's talk about New York response first. As we know, the governor announced last week a mask and vaccine requirement for all indoor public spaces that went into effect yesterday. It will be reassessed in January 15th to prevent further shutdowns. This is a little bit greater mask requirement than we had implemented in Erie County. In Erie County, we required it for all indoor public spaces. What the governor has done is required it for all places, basically, except for private residences. So businesses, even if you have a back area where that is not open to the public, you're required to have your staff wear a mask. In Erie County, our mask requirement was such that as long as it was not a public-facing location, like a manufacturer where the public didn't tour the floor, things like that, we were not requiring masking. The governor has issued, through the Department of Health Commissioner in New York State, Mary Bassett, an order requiring everyone, basically, except those that are in their own private residence, to wear a mask. And I do thank the governor for taking certain action to do this. We see the numbers across Erie County. We know what we were dealing with. We've seen the declination in cases, hospitalizations, and making comparisons to our friends in the rest of Western New York. We believe the mask mandate made a difference in Erie County to help us reduce our numbers, especially as compared on what would be considered the per capita basis, the positivity rates, as well as the 100,000 average population over 7 days compared to the rest of Western New York. Masks work, in our opinion, and that's why I do thank the governor for taking that action, but also for calling up the National Guard to help at Terrace View, the ECMC nursing facility, as well as providing assistance to ECMC from the Northwell, which is a major hospital system in the southern part of New York State, bringing some nurses up to help ECMC with its issue, because while our hospitalizations have declined, ECMC is still basically at 100% of its patient count. Now, Erie County implemented a 4-phase approach to reduce cases and control hospital capacity. Of course, we've been in phase 1, then we have phase 2, which would be a vaccine mandate, phase 3, capacity restrictions, phase 4, shutdowns. We said we would review after approximately 3 weeks of data. So yesterday we sat down, our policy group met, we made a determination based on what we've seen. We are staying in phase 1. So Erie County will remain in phase 1 as amended by New York State. I have to say as amended, because of course the governor instituted a mask mandate, which is a little more restrictive than what we have in Erie County. So that is the rule. That is the rule because it came from the governor. So we will stay in phase one, the mask mandate, or you could have a vaccine requirement as long as everyone's vaccinated and you confirm it through your review of people at the door. But we've seen some positive notes. It's not great what we're seeing in general, but we have said positive notes, which is recent reduction in new cases, positivity rate in cases per 100,000 over a 7-day period. Erie's positivity rate in new cases is 2 to 3% lower than all other Western New York counties that did not have a prior mask mandate, and of course until the governor implemented it. New York State mask rules will now apply to more locations. We had it for the public-facing locations. Now it applies for basically every public location when we meet, including private businesses. It just does not apply to private residences. And hospital capacity in the county is stabilized. We are not seeing that trend upward. Since we did the mask mandate, we've sort of leveled off and we've kind of stayed like that. That's a good thing. We want to see that number go down. We feel confident in the long run it will go down if we continue to adhere to the rules. So, phase one stays in place. Masking works. We know it works. Please wear a mask because my mask protects you, your mask protects me, and together we will protect each other so that we can get through this most recent wave of COVID. With that, I'm going to turn it over to Dr. Burstein to talk a lot more about some of the things we're doing, including programs that we have upcoming to distribute masks to the public, as well as, of course, the vaccination clinics we have. So, Dr. B.
Thank you, County Executive. So, as the County Executive mentioned, we are looking out for masking and helping to facilitate masking. So, since before Thanksgiving, our Erie County sanitarians have been going out and when they inspect restaurants and they look for making sure that people are masking, both the employees and also the patrons. And then also they've been responding to complaints about masking. But, in general, our sanitarians have told me that they found that like most Erie County residents, when they go out and look at people who are masking, everybody's masking. Most people are masking when they're out in public. Of course, there are going to be a couple that may not mask, but when they're going out to restaurants and to go out to educate in retail stores, shopping, grocery stores, most people are masking inside. So, on behalf of our Erie County sanitarians and behalf of myself and the Erie County Health Department, we want to thank Erie County residents for masking up and doing the smart thing to protect us all from COVID-19 transmission. So in addition to inspecting and responding to complaints and educating about masking, our Erie County sanitarians are actually distributing masks to help people mask up. So, so far, our sanitarians have distributed 60,000 procedure masks and 15,000 cloth masks to local businesses. We've started out in the most densely populated areas in the city of Buffalo, and now we're branching out into suburban and rural communities. So we are really trying to help people mask up. And it doesn't stop there. We've been working behind the scenes to make sure that Erie County residents have access to good protective masks. So since November, the Erie County has distributed 715,000 masks, and we are distributing more. So our sanitarians, every time they inspect a business or a restaurant, they bring the masks for the businesses and the restaurants to distribute to their employees and patrons. We have masks available at all our vaccine clinics, so when you come in to get vaccinated, you can get a vaccine and you can pick up some masks for yourself and your family. We are also giving masks to group homes, homeless shelters. We've been giving masks to Feed Nor Western New York and food pantries. We've given masks to child care providers, senior dining sites, our first responders, and also we've been working with the International Institute to distribute masks to refugee and immigrant-owned businesses. So we've been trying hard to get masks out in our community. So actually starting tomorrow, there'll be more sites that are available to pick up masks for Erie County residents. We are going to, tomorrow, with the Buffalo and Erie County libraries, including the central and branch libraries, will have masks that people can pick up and to take home for their own use. We were also going to be giving masks to our Erie County legislatures for them to distribute to their constituents. And then we have these pushbacks that we're giving to nursing homes and assisted living facilities with masking and other PPE and disinfectants to make sure that everybody stays safe there. And we're also scouting out new sites throughout the county that we can have like pop-up masking distribution sites so that people can have access wherever they are to good masks. So moving on to vaccines, we just really want to emphasize the importance that everybody the age of 16 and older who is eligible for a COVID-19 booster get that shot. So as you probably all have heard that last week, the FDA authorized Pfizer COVID-19 vaccine for emergency use for booster doses for people who are 16 and 17 years old. So now any teen who is 16 or 17 years old who received their second Pfizer dose 6 months ago or more, they are eligible to get a booster dose of Pfizer. So I really encourage parents to get their kids that booster dose. It is very protective. Also, anybody who is 18 years or older who received their second Pfizer or Moderna vaccine 6 months ago, or who received their Johnson & Johnson COVID-19 vaccine at least 2 months ago, are eligible for that booster dose. So really want to encourage everybody who is eligible to get a booster dose to get that shot. It is so protective. We know that with these emerging variants in our community, like the Omicron, and there can be other variants coming in, the booster dose is essential to protect people. We know there have been some good data published that that 2 doses of the mRNA and 1 dose of Johnson & Johnson is probably not enough to protect us for these new variant strains. So it's really important to get that booster dose to protect against the variant strain and this Delta strain that can be very deadly. And so we have many vaccine clinics throughout Erie County, both through working with our Erie County staff and with our partners. Just to facilitate, make the appointment more streamlined, we'll encourage everybody, whether they go to our vaccine clinic or another vaccine clinic, is to bring your vaccine card and a photo ID. It's available. It'll just speed up the process of registration. So we, at the Erie County Health Department, we have various vaccine clinics where we're offering Pfizer and Moderna to all ages 5 and up throughout the county. So we have a little schedule now where on Mondays we're at the Amherst Adult Day Services near the Amherst Senior Center. Tuesdays we're at the Delavan Grider Community Center. Wednesdays we're at Chestnut Ridge Park in Orchard Park. Thursday, we're at Elmo Meadows Park, and on this Friday, we're going to be the Orchard Park Fire Company. So all our vaccine clinics operate between the hours of 11 a.m. to 7 p.m. We encourage everybody who wants those doses, whether it be your first, second, third, or booster, to make an appointment either by calling 716-858-2929, or you can go on our vaccine website at erie.gov/vax, V-A-X, and see what time and location is right for you and make your own appointment. We do welcome walk-ins, so people who are like, hey, I'm in the area, I might as well get a vaccine. Of course, we prioritize people with appointments, so the best time for walk-ins to walk into one of our clinics is between the hours of 5 and 7. Usually our clinics are not that busy, and it's really easy for us to accommodate walk-ins. So we also have some brick and mortar vaccine locations. We're at every day, Monday through Friday, we're at ECC South between the hours of 12 and 4, except on Wednesdays, we're open till 7. Also, we are partnering with Buffalo Home Care. They are offering vaccines for the Erie County Health Department at their 490 Delaware Avenue office, and also they have a new location at 5847 Transit Road in East Amherst. It's really in the in the middle of that big strip mall restaurant shopping area. So they're open weekdays between 9 and 8. So on your way home from work, you can stop in and get a vaccine, take your kids after school, and on the weekends, they're also open from 9 to 5. And so if we give other options for COVID-19 vaccination, So say you want a vaccine, but it's you prefer get the vaccine in the comfort of your own home. We can do that for you. We have our Vax Visits program. Again, all you have to do is call 716-858-2929, and we will give your information to Buffalo Home Care, and they will contact you and arrange a time that is convenient for you to come out to your home and get a vaccine. If you want to see where all our sites are, you can go to our Erie County website at erie.gov/vax, V-A-X. If you want to see where all the sites are in the community that even are not ours, you can go to the vaccines.gov website and just to look at where else vaccines are being offered. We know that many pediatricians' offices and community providers are offering the vaccine to their patients in their offices, so check with your provider if that's a place where you'd rather get a vaccine. And we're also still partnering with schools throughout Erie County to set up vaccine clinics in the schools, including in the Buffalo Public Schools. So more to come on that. So, again, with just in terms of controlling COVID-19 spread, it's so important to know your status. If you have symptoms of COVID-19, even if they're like tiny sniffles, even if you've been fully vaccinated and boosted, it's so important to know your status and get a COVID-19 test. So we are offering free testing through our Erie County Public Health Lab. Monday through Fridays, we have molecular PCR testing. Usually the results are back between 1 and 3 business days. Usually it's on the shorter side, between 1 to 2 days. We also offer our point-of-care rapid molecular diagnostic testing for symptomatic K through 12 students and staff. All our positive PCR specimens are sent to UB to do genetic sequencing. So we are on the lookout. We're partnering with UB just to make sure that we know if there are any variants like the Omicron in our community. So far, the UB has not found any Omicron, but anything can happen. So again, for testing, appointments are required and we are offering testing to Erie County residents at 716-858-2929. So please get a test. And it's something to consider if you're going to go to a holiday party. We know that there are holiday parties happening this weekend and next weekend. You want to make sure that you're not going to be an infectious disease vector and transmit infection to everybody else at the party or your family. Get a test. It's the best way to know your status. So another friendly reminder about another respiratory infectious disease that will be coming upon us and has actually already transcended into our community is influenza. It's almost flu season. So this graph is from this past week's New York State Department of Health influenza laboratory report that looks at reported influenza tests throughout New York State. And I want to bring your attention to the red line, which is looking at the number of reported positive flu tests in New York State so far. So you can see that the number is low. We usually peak in flu season at the end of January or beginning of February. However, the take-home points are we do have flu here now. Whoops. It is here now. It's something that we have to protect ourselves against. And you can see that the red line curve is much steeper than the brown curve, which was from 2019, or the blue curve, which is from 2018. So we really have to be careful because we have more flu now than we have in the past 3 years. So the best way to protect yourself against influenza illness is to get a flu vaccine. You can get a flu vaccine at the same time you get a COVID vaccine, the day before, the day after. It doesn't matter. When you receive one dose doesn't matter where you receive a dose of the other. So please talk to your healthcare provider, talk to your pharmacy. Get a flu vaccine because that is another infectious disease that can cause significant illness. And we know the hospitals are already full, almost at capacity, although we're leveling off with COVID-19 admissions. We don't want to see another burden of influenza admissions into our hospital and overwhelming them again. So I'm going to turn over to our county executive for questions and answers.
Thank you, Doctor. We have seen a declination in cases, positivity rates, and case rates per 100,000. We are a little concerned about the Christmas season, of course, because we saw a big spike last year as well. So we know we had a spike for Thanksgiving. It has reduced, seems to be heading in the right direction. We want to continue that trend, so make sure you wear a mask when you're out in public. And be careful if you're going to a private party and stuff like that, and people aren't wearing masks. You might want to, you should wear a mask, and you might want to consider getting tested before you go just to find out if you're positive or not. So we will entertain questions, and we'll start with Channel 2, Kelly Dudzig. Are you on, Kelly?
I am here. Thank you for taking my question. So, with mask compliance high in Erie County right now, where are you finding the bulk of the spread happening, especially in that 30 to 39 age group where the cases are higher than the other age groups?
I'll turn it over to Dr. Burstein. We are seeing some transmission, of course, still among family units, but in the 30 to 39, it kind of ranges all over the place, so I'll turn it over to the doctor.
Thank you. Well, according to our contact tracers, as the county executive mentioned, we are seeing transmission within households. Households are very high risk of transmission, and that's why our contact tracers, really try to target the households for their case investigations and making sure that everybody knows what they need to do to stay safe in the household where there's been a case of COVID-19. We're also seeing a lot of spread in social gatherings. People gathering in their house, small parties or large parties, people gathering, starting at bars and, hanging out together and then maybe, going to a friend's house. So, much of the spread is happening in people's private residences, even their household, among family members or at gatherings with friends and family. So that's why it's really important, as the county executive mentioned, to really make sure you stay safe in these holiday gatherings. Wear a mask if possible. It'd be great if you're going to host a party, you make it a requirement for all your guests to be fully vaccinated, maybe even boosted. And then, making sure that keep the gatherings smaller is safer, and then asking people to get a test before they arrive. So those are all things that we can do to decrease the risk of COVID-19 spread during the holidays. We don't want to see, another surge in cases like we did after the Thanksgiving holiday. Thanks.
Sandra Tan, Buffalo News.
Hi, thank you. A couple of questions. One, this might be for the health commissioner. Is there any difference in approach this time around through this most recent surge in contact tracing or enforcement measures that the health department is undertaking? And on an unrelated matter for the county executive, you had previously stated that you were hopeful that you would be able to publicly announce the bones of a stadium lease deal, just the broad terms, by the end of the year. I don't know if that's still the case, and if not, when are you thinking that would be happening?
Well, I'll answer the question regarding the football stadium. The discussions are ongoing. These are complicated discussions and transactions. We're not talking about the equivalent of a lease for a 3-bedroom apartment. We're talking about a potential new stadium for the Buffalo Bills for the next 30 years. There's a lot that goes into it. So the negotiations are still ongoing. Our council talks almost every day. Principals talk frequently. And I would just say that when we have an opportunity to announce a transaction, we will. We are not there yet. If we were, you would have heard about it. We would have announced it. But the discussions are ongoing. And I do know that yesterday council talked once again, the council for the Bills and the state and the county. And we continue to move forward until we reach a point where we can announce a deal. I don't want to get into the particulars of where we are at this point, but discussions are ongoing. And yes, I'd like to get it done by the end of the year. The most important thing is to get a deal done. Whether we announce it tomorrow or sometime in January, it's to get a deal done that is a fair deal for all. So I'll turn it over to Dr. Burstein to answer the first question.
Thank you. So, we've had a huge surge of COVID-19 cases in the past couple weeks. So, with the Erie County Health Department, we've really had to prioritize our strategy in terms of case investigation and contact tracing. So, number one, we ensure that every single COVID-19 case that is reported to the Erie County Health Department gets contacted by one of our case investigators within 24 hours. Usually it's much shorter than that. As soon as the lab report is hot off the press, we will try to reach out and contact that individual, let them know that they're positive, let them know what they need to do to isolate safely and prevent transmission to the people around them. We also are aggressive about prioritizing the high-risk close contacts. So the highest risk close contacts are people in the home. So we conduct a thorough investigation looking at who those close contacts are in the home, making sure that they all know that they've been exposed, determining if they need to quarantine, if they haven't been fully vaccinated, and the signs and symptoms that they need to look for if they were possibly develop an infection themselves, making sure that they know to mask, and then making sure that they understand that they should test 5 to 7 days after their last contact. And even though they're all living in the same house, it's really important that the case isolates from the rest of the people in the family to prevent continued risk of transmission. So we also prioritize school contacts. So anybody in K through 12 or daycare, we make sure that we prioritize those case investigations, and we notify all close contacts in schools and daycares. Again, we see transmission there. Those are high-risk, vulnerable populations. So again, we make sure we do complete contact tracing, case investigation, contact notifications in those settings. So with just in terms of other close contacts in the community, we work closely with our cases to make sure that they understand who their close contacts are in the community that are outside the household or outside schools, and making sure that they understand that they need to notify themselves their close contacts that they're positive, their close contacts could be exposed, and they should take the appropriate precautions either to quarantine if they're not fully vaccinated, or making sure if they are fully vaccinated that they're watching out for their symptoms, making sure everybody's fully masked for 14 days, and make sure that they get a test 5 to 7 days afterwards. So this is a strategy that we've implemented. The state supports this. We work with our state contact tracers in the same protocol that we're using. Talking to my local health department, public health directors and commissioner colleagues, many of them are adopting this strategy too. So, for people that need documentation of either their isolation or quarantine period, they can get all of that from our Erie County Health Department website. They can download those documents themselves, attest that they did isolate or quarantine and put down the specific dates, and attest, and they can use that in terms if they need to provide documentation to their employers or to their school or to whoever. So that has been our prioritization approach. So we feel that that this is working. You can see that our with masking, vaccinating, the contact tracing approach we have with prioritizing high risk close contacts, that our numbers have stabilized and is even started decreasing, including in the hospital. So we will continue that approach for now, where our numbers are high, and we can reassess once our numbers start to decline even more.
Okay, Emily Stoll from B News, do you have any questions?
Yes. So I know we've talked about the numbers for like who's fully vaccinated, who's only got one shot. What are the numbers looking like for boosters, and how many people are getting those?
I believe we're around 25% of adults have been boosted. Doctors nodding her head with yes. We can give you the exact total. It's not where we want to be. We know the booster is the key, especially with Omicron. It seems to offer tremendous protection for Delta and Omicron. So if you have not gotten your booster, you should get your booster. Remember, you can still catch COVID even if you're fully vaccinated. COVID, the vaccine protects you. If you're boosted, it really protects you, is what the data shows, especially coming out of Europe. But we'll get you the exact number with regards to those that are boosted, we believe it's, I think it's around 25% of those that are 18 and above. Emily Watkins, WBFO.
Hi there. Thanks for taking my questions. I have two, hopefully quick questions, and they're probably more for the health commissioner. But I'm wondering about, obviously, there's not only two outcomes of COVID, right? There's not just you fully recover, there's hospitalization. I'm wondering if the county has any information about what the outcomes are looking like for people as far as, after hospitalization. You mentioned a lot of people on airway assist often have longer term health issues or health conditions after that. So I'm wondering about what things are looking like as far as the non-lethal outcomes of COVID right now for people in Erie County. And I'm also wondering how the high COVID case rate is impacting people who have medical conditions that leave them at higher risk for COVID-19 or infections, such as people who might not have a full response from the COVID vaccine due to transplant or medication. So I'm wondering, two questions: what are the non-lethal outcomes of COVID right now? And are we seeing rates also increase in people who have health conditions that put them at higher risk of COVID?
I'm going to turn that over to Dr. Burstein to answer as best as she can, because I'm not certain we have all the data.
Right. So thanks. Those are great questions. Unfortunately, from the Erie County, Health Department side, from our surveillance side, we don't receive data about outcomes of people who've recovered from COVID-19. From the medical literature, there's still like a significant proportion of people who, before COVID might have been, well, have no underlying disease, who continue with residual symptoms for months after their official recovery of COVID-19. The most common symptoms that persist are loss of taste and smell, also fatigue. Those are and also some coughing and some respiratory difficulty. So those are the most common symptoms, and for some people they can persist for months or longer. However, from the Erie County Health Department side, from the surveillance side, we don't have exact data from that. I'd encourage you to reach out to hospital-based physicians and see what they're seeing among their patients that have been discharged. I believe that UB has, the specialists, like the pulmonary specialists, may be following many of these cases. And then just in terms of the risk for people who are immunocompromised, we know that people who are immunocompromised who develop a COVID-19 infection are much more susceptible because even if they've been fully vaccinated in boosters, they still may not have the functional antibody response to protect themselves against severe illness and death. And in addition to people who are immunocompromised because they have a hereditary disorder or they're receiving medication for some type of autoimmune disease or for cancer, everybody, all our seniors are immunocompromised, and the older they are, the more immunocompromised they are, especially people over the age of 80. I mean, they are like extremely immunocompromised. So, it's really important that we make sure that we, keep our most vulnerable protected. And again, we don't have information on all our cases, the immunization status, but we can look from our hospital data and from our death data that many of those people end up in the hospital and unfortunately end up dying of COVID-19 related disease do have comorbidities, and so they are more vulnerable, and that's why it's really important that they get fully vaccinated in boosters, so they get their third dose, and then 6 months after their third dose of a Pfizer or Moderna, then they get their booster dose, so they can get 4 doses total. And then also the people around them have to be boosted, make sure that they mask, because we have to act like a cocoon and protect those vulnerable people by making sure that we don't get infected so that we don't transmit infections to them. That's all something that we have to work together as a community and as a family to make sure our most vulnerable populations stay well. Thanks.
Tim Wanger, WBEN, are you there, Tim?
Yes, sir. Thank you, Mark. You probably heard the governor's briefing earlier today, and she was peppered with some questions about enforcement. You've had the mask mandate in place here in Erie County for a few weeks, and you've cited the results of it. Enforcement is being questioned. She said that the enforcement is in the hands of the county, yet there are, municipalities, there are businesses who are not enforcing the mandate. Can you just who's enforcing it, and what ramifications are there?
There was a little break up there, but I think you're talking about enforcement. We have had our sanitarians go out since we issued the mask mandate. They will continue to go out. They will educate. We issue warnings before we issue fines. We generally find that if our sanitarians go out and they issue a warning, that when they return, that the businesses are following the rules, because nobody wants to be fined. And so that's good, that they're actually following the rules. There's a very vocal minority that is against masking, but the majority of folks understand it. We know that. The majority of folks in Erie County, the majority of folks in New York State, the majority of folks nationwide support this as a measure to prevent the further transmission of COVID-19. So while there may be some out there who are like, I don't have the capability of doing the enforcement, some of the smaller counties, it's understandable if they have very, very small health departments in which they may have 5 or 6 people in the whole health department because the county is a very small health department. But we have the capability here. We've been enforcing all along and will continue to enforce. But the most important thing lately is businesses have been following the rules. Even those that may be begrudgingly doing it, they're following the rules. And that's the key, that businesses are following it and our sanitarians are going out. I would suggest if you have additional questions, you should contact the state and determine what the state says. The governor said something earlier, but we enforce the rules. We'll enforce the rules as they pertain to Erie County. We'll enforce the rules as it pertains to New York State. And I would just hope that media understands they need to get the fair message out. And when individuals, whether it's on the radio or television, are advocating against following the rules, they're only creating more COVID in our community. And then media outlets should be held responsible for that. Next comment. Next, you had your question, Tim. We answered it. Channel 7, WKBW. And no one on for Channel 7. We'll move on to Channel 4, WIVB-TV. And Channel 29, Fox 29. Okay, then the last question will go to Spectrum News, if Spectrum is still on. Thank you. We appreciate all the media's participation. It's important to get accurate information out to the public, as I've said before. Facts is what matters. You're entitled to your opinion, you're not entitled to your facts. The facts are that our numbers have been declining in the last week or so. Our case rates have been going down. Our positivity rates have been going down. Our rate per 100,000 over a 7-day period has been going down. We're doing better than other counties in Western New York that have not until recently had a mask mandate in place because of the governor's order. I think that goes to show that people in Erie County are understanding the situation. They're putting on masks. They may know somebody who's gotten COVID-19 and is sick recently, or hopefully not, but I know a lot of people who've unfortunately had people who died as a result of COVID-19. So I thank everyone for following the rules, doing what's right to help protect our community. We are all in this together. We are our brothers and sisters keeper. As COVID-19 numbers increase rapidly across the United States, we need to do our best to protect ourselves here, and I want to thank everybody for taking the correct action so that we are protecting ourselves and we're keeping our case rates down and our hospitals don't get overrun with patients. Because remember, it's not just about COVID-19, it's about what happens if you're in a car accident. What happens if you are have a heart attack? And I'll give you an example of it. This has not been publicized, but earlier today, an Erie County employee who works at our public safety office on Elm Street was crossing Elm Street was hit by a vehicle crossing Elm Street. The vehicle sped away. It's a hit and run. We do not have information on the vehicle. The employee was injured, broke a leg, was taken ECMC, needs surgery, has to stay overnight. So I do offer my best wishes to our employee who unfortunately was hurt as a result of someone's negligence who hit them on Elm Street. If you have information about this accident, if you witnessed it, if you got a license plate, please call our 911 dispatch center so that we can deal with this issue. But this is an example of it. An employee was walking into work today, crossing Elm Street, was hit by a vehicle, was severely injured, taken ECMC. It sounds like the employee will recover, but required surgery to fix the broken leg. If there had been no beds available, the ICU was completely full, I don't know what that outcome might have been, but there were beds available in the ICU. And so our employee could be taken care of and hopefully successfully will recover. This is not just about you. This is about us. This is about all of us. It's about protecting our public so that we're not only continuing and stopping the continual spread of COVID-19, but we are ensuring that there are beds available in case you are unlucky and get in a car accident or have a heart attack. It is about all of us being our brothers and sisters' keeper. I want to thank everyone for doing that. It has made a difference. We are headed in the right direction. We're doing better than other parts of New York State right now when it comes to our rates are declining while other areas are going up. And to everyone, regardless of where you live, I just ask you to wear a mask, to protect yourself and to protect others, and then we will all get through this together. Take care, and until next week, be safe and well.